Good evening, everyone. I'm Dr. Nirima. I'm also a student at ASCI. I'm doing my hospital management here. So something I really wanted to ask here is, the panel have talked about comprehensive healthcare. So general practitioners taking over instead of specialists. So, and also a statement was made that most of us here are we are blessed to have access to healthcare. But I would disagree with that statement because being a doctor myself, I struggled for 3 to 4 years to find a therapist who can help me with my depression. So I am saying there are issues in healthcare like mental health which need to be prioritized but are not yet prioritized. So sir, as you said, UHC is a solution to our problems. Do you think UHC settles the problem of mental health support rising in India? And my other question, I'm really sorry for extending this session. The other question is, one of the insights that you mentioned in your book is about non-for-profit organizations supporting in UHC. So we have also seen many NGOs, they are struggling with financial sustainability, how to sustain their models right now. So how do you think they help in this scenario? Thank you.
I prefer the others answer since you directed it to me. Comprehensive health includes mental health. I mean, it's not very different from cardiovascular health or kidney health. It's all one thing, right? So, in my view, the community health worker who comes to your home, and you may invite him or her once a month or once in 3 months or once in 6 months. That should be up to you, right? But there should be some constant rapport. You will trust that person. So you need to see a therapist. You will call your community health worker and say, I think I need to see a therapist. Can you please tell me where to go? The community health worker should be the resource person who tells you, okay, there is a therapist here, and I'll fix up the appointment for you, and you go there and see the person. And the comprehensivist who's responsible overall by the physician who's responsible will be informed of it electronically. He doesn't need to have to see you, right? So I think technology, restructuring the system so that community health workers are much better trained and bringing about transparency in all these records and things like that. And when I say transparency, don't mistake me. I'm not saying that your record should be available to me. I'm saying that your record should be available to you, which is not the case today. You go to a hospital and they may give you a few sheets of paper. They don't give you an electronic record always, as far as I know. So I think that problem will be solved.
I just want to do a small fact check here. In 6 years of Ayushman Bharat CHO training, that is community health officers who are supposed to man 1,50,000 Ayushman Bharat clinics. Numbers trained in 6 years is 37,000 as of last week. 37,000. Numbers to be trained is supposed to be 3.5 lakh. 37,000 in 6 years. If we go at this rate also, multiplied by 2 times, it will take us 4 more years or 5 more years to train CHOs. Training is terribly difficult. For all the resources, experience, capabilities and all that, a figure actually stands out by Dr. Kakarla said 353. Because it is difficult to train people. Difficult, very difficult. You don't get competent teachers to train. You don't get competent environment to train. And training is lengthy, 6 months, 4 months, 8 months. So it's going to be a very big challenge to man that level. So 3 lakh people who are going to be CHOs, believe me, it will take another 7 or 8 years. It's not easy. Dr. Somaraji used to talk to us about primary care cardiology training for people, physicians. I had long meetings with him number of times. Nothing came out till me. So it's challenge. Training is one of the biggest challenge. I have been in the ecosystem of teaching, learning, healthcare for the last 10 years. Believe me, you never make money, but you don't do enough work, you don't get satisfaction. That's a challenge.
Just to add about training, I think we are a training institution. So some states like Kerala, I think understood this. So they sent their entire healthcare, I think all the district level authorities, and they did a 1-year course. They said, let ASCI train us for 1 year not just on health insurance, but on health economics, public health. So we did an online program, and then they came out to campus. Then we looked into some of the social skills. Then we went and told the National Health Authority. And very interestingly, we found those of you who are manning the Ayushman Bharat program there, none of them had any understanding of public health. So they said, we know the program, we know monetization, we know fraud, we know this packages, we know the rate contracts, but we don't know what PHC is, what is this comprehensive healthcare. So we did actually a 3-day, 4-day training here. It was a very basic. So I fully agree that there is a sort of a lacuna there, and some states are proactively sort of taking it. And unfortunately, the thing is, the last thing they do is to cut off budget is actually the training, where it should be actually in the higher side. Coming to also one point about mental health, I think thankfully, over a period of time, I think thanks to maybe COVID, suddenly, we do have a mental health program for years, but I think suddenly, government also has realized, I think now at least in the group, we are all here, somebody says I'm depressed, they are not looked at as psychotic patients. Whereas there was a time people used to have my daughter in school says, so when I go home, sometimes I say, no, I'm feeling low, she says, do you want to be the therapist, she's asking. In the sense, school mein that awareness is being created. Which means I think we are on a sort of positive side, there's nothing wrong about this, but it has to percolate at the sort of a district and the sub-district level. Thank you.
Any other questions?
It's not a question, it's a comment to what you were talking about, home care and other things. How many of us have struggled with a taxi wala about 15 years ago coming out? You engage a taxi from an airport or something, he'll go around and then you'll be taken to one person will charge you 200 rupees, 300 rupees. Uber came in, everything came to a particular standard. Cheating came down, you are picked up at the spot, delivered at the spot. So please do not decry the private enterprise where the government is not able to deliver. So we need to have innovative solutions which can sustain themselves. And it's a win-win situation. So if there is a model where the person whom we engage as a home helper, he should be kind of given a, say, a 4 or 6 week orientation. I'm sure if Swiggy or Uber had taken it, there will be a form in which they are trained before they are delivered into the field. So you need to have a comprehensive mechanism. It will be a real win-win situation. I'm sure there is a lot of need. Only thing is we haven't struck the right way of delivering that care.